This morning, we are looking into the treatment options available to patients fighting colon cancer. Joining me now this morning is Dr. Alex Krin, who is a surgeon at HCA Florida Memorial Hospital. Good morning, and thank you so much for joining us.
Morning, Corley. Thanks so much for having me.
First off, can you tell us what chemo treatments are available for colon cancer patients?
Yeah, great question. So, colon cancer in general is treated by a combination of surgery, sometimes radiation, and sometimes chemotherapy. There are a lot of traditional chemotherapies that have been researched and used for many years that are very, very effective. And typically those are given to patients either before surgery or after surgery, depending on what your stage is of the colon cancer.
And how do we monitor patients after treatment for colon cancer?
Yeah, so, after someone's been treated successfully, we monitor them with a few different ways. So we check some laboratory values that can help us indicate if a cancer is returning. They get a series of imaging studies, which is CAT scans or PET scans. And then they also get their what's called surveillance colonoscopies, where their surgeon or their gastroenterologist goes and looks at the area where the cancer used to be to make sure that nothing's coming back.
And what new research is ongoing to decrease the rate of recurrence?
Yeah, so there's some really exciting stuff going on. This actually came out of Barcelona, Spain, and recently just got published earlier this summer. Basically, the chemotherapy treatments that we give after surgery are very, very effective, but there is a small proportion of patients where the cancer returns, usually sometimes months or even several years later. So what they're looking at is trying to adjust the treatments and target them so that the cells or the pieces of the tumor that are evading the chemotherapy can be attacked so that we can really drop the rate of anyone having their cancer return.
Oh, that's very interesting. And how often do patients need to receive this type of treatment? Every few weeks, every month?
So with the typical chemotherapies right now, they're usually done in cycles of every few weeks. With this new research, and again, it's still very early on, but some of the discoveries that have been made are very fascinating. What this will hopefully allow scientists and pharmaceutical companies to do is to develop new medications that can really help that small proportion of people that have their cancer return after treatment.
And how effective are these treatments?
The current treatments are very, very effective. Colorectal cancer is one of the top 3 most common cancers in the U.S. for both men and women. So we have, a lot of patients that we're treating it for. Majority of patients get their combination of treatments either through chemotherapy, radiation, surgery, and they're done. But a very small amount of patients, despite the excellent treatments we have right now, do have a return. And that's why this research is ongoing in places like Spain and in the U.S. as well.
All right. Well, this is wonderful information. Thank you so much, Dr. Krin, for joining us this morning.
Great, Corey. Thank you so much. Have a great day.